Good to see you, Sam.
Hey. Tell us about your work and how it fits in studying heart disease.
Well, I'm really interested in the link between depression and heart disease. So you mentioned that heart disease is the #1 cause of death in this country and even the world. And actually the #1 cause of disability, lost productivity, and that sort of thing is depression. Okay. And depression and heart disease are strongly related. People with depression have a 60 to 80% higher likelihood of developing heart disease.
So just the lifetime experience of potentially getting depression may suggest risk for heart disease later on in life.
Exactly, and there could be a lot of reasons for that. But when we take a step and look at it, heart disease and depression are very similar in what they look like. They kind of happen across the lifespan, and they happen as a result of how people live their life, taking into account also their kind of the hand they've been dealt genetically.
Sure.
Yeah.
So, but that's an exciting idea to begin to try to address depression in order to prevent later heart disease.
Exactly. I mean, that's really the goal of my research, and kind of my career-long research question is, what is the role of depression treatment in preventing heart disease? And there's a lot of factors that can connect the two. So there are a few that I'm really interested in, but one of them is the lifestyle factors that connect the two. Because of those similar, depression develops across the lifespan. It develops from people based on how people live their life. If people live their life in a way that welcomes depression, then it happens. If people live their life in a way that welcomes heart disease, then it's more likely to happen. And so what I try to look at is understanding how we can change that. So with the lifestyle factors I mentioned, things like people who are depressed are more likely to smoke. They don't get as much exercise. It's harder for them to make any changes that their doctor might recommend. So if they have high blood pressure early on or something like that, it's harder for them to make the lifestyle changes that they need in order to prevent cardiovascular disease. So this is our lab, Sam. And we've actually got a lot going on here. Not only is this my cardiovascular psychophysiology lab, but it's also Dr. Everhart's cognitive neuroscience lab. So in one space, we've got heart and brain. I'm getting all kind of information from that. So I mentioned downstairs that there were a lot of reasons that depression and cardiovascular disease might be connected. One of those reasons is that people with depression tend to respond to stress differently, physiologically. So their heart, their blood pressure, it tends to be different from people who don't have depression. And that may be one of the reasons they go on to develop heart disease at a greater frequency.
Makes sense.
So I thought I'd show you a little bit, if you can have a seat here.
Sure.
So Sam, let me show you an example of the kind of things we do in this lab. We like to measure people's physiological reactions to stress. So we do that with heart rate and blood pressure, but let me show you the blood pressure.
All right.
Just so we don't have to hook you up to a full EKG. So the cool thing about this machine is that it not only measures your blood pressure, just, in a doctor's office, it goes off, it tightens up, and then it relaxes. It gives you one measurement. This machine actually measures your blood pressure as it changes from second to second. So it really gives us a lot of information, a lot of great data. So here's what I would do with someone who had depression. I'd bring them into the lab. I would hook them up to this machine, start it up, feel that thing inflate. So it would get all set up, and then I'd be able to measure what their body's doing. Then I would kind of stress them out a little bit. Usually that's done with something very simple that just gets their body going. So for example, Sam, if you could count backwards from 7,000 by sevens and just report the answer each time, that'd be nice. You don't have to do it.
Yeah, I would definitely claim absent-minded professor in this play.
But that's the stressor that we use. And lots of people in the research use this, and we can compare our studies.
Sure.
So after I got that measurement, I would take them into depression treatment, do some kind of psychotherapy. We use behavioral activations, very good way to treat depression. And then once their depression was alleviated, bring them back into the lab and see if that improved their physiological response to stress.
Mm-hmm. And what has your research shown so far?
So far, we're still getting the study going, so we're just kind of recruiting people. I can't really look at the data until we have all of it in, because I don't want to be biased.
Right.
But we're expecting to find that at the beginning, people's stress response is kind of blunted. So you don't see much going on. They're just kind of rolling with it, and it kind of fits with how you might think of someone with depression. They're just kind of there. They're not really getting engaged in life.
Right.
After treatment, I hope to see that physiological response is better. So they have a nice little stress response when I ask them to do that kind of mental math.
Sure.
And then afterwards, which is what I'm really interested in, they recover well. because people with depression generally don't recover well from stress. Their physiology stays high for longer, which, as you can imagine, more wear and tear on the heart that might contribute to cardiovascular disease.
Sure.
So what I'm hoping is body recovers nicely after the stressor. All right, so Sam, this is one of our clinic rooms. This is where we actually do the therapy as part of that upcoming study. Take a seat. And just wanted to let you, most people come into rooms like this, you not because you're a therapist, but a lot of people are asking, where's the couch?
Sure.
Where's the couch that you lay down on and talk about your dreams and that sort of thing. Dreams isn't things that happen at night, not aspirations for the future. And so, psychology, as you know, has come a long way since then. We're using types of therapy that really have a stronger grounding in theory and in empirical evidence. And so the one that we use for the depression treatment in the study that we talked about earlier is called behavioral activation. And you're, of course, familiar with cognitive behavioral therapy, CBT. Well, behavioral activation is the B in CBT. Okay. It's about the behavior and changing behavior. So the theory is, and the understanding is, that depression comes from living in a certain way and exhibiting certain behaviors that cause depression, that keep it around, that maintain it. So we think that people who are depressed because they're not getting what they want out of their life. They're not getting what they want out of the environment. So if it's someone who's unemployed, they keep applying for jobs and not getting it. So who wouldn't become kind of down at that?
Sure.
Who wouldn't just want to give up and not really keep trying to get jobs and just kind of keep going where they are? That's a very simplistic example.
Yeah, sure.
But that's kind of one way that we think that depression is maintained.
Okay.
So someone keeps trying, maybe they want to be more social, so they try to find friends and they go and talk to people and they're just not getting the responses that they want.
So just no rewards for all their actions.
Exactly, no rewards going on. They're not getting what they want out of life, out of the environment, out of anything. And so that's what we think it's a cycle. So people feel bad, so they do less, and they do less, and then they feel bad. And it just keeps this cycle, this circular habit going.
Yeah.
So what we do with behavioral activation is we identify things that people can do that'll break that pattern. And we do that by talking with them about their values. So what do they think is important to them? What do they want out of life? What is the life that they want to live that they're not getting? And once we understand that about someone, then we can target specific things to get them to do, just to get them closer to that life they want. In very small steps. That's why it takes a therapist. So you can see the parallel here to heart disease. This is where the behaviors change and people do things differently in order to prevent heart disease and to improve their mood. So part of why they're feeling down might be because they want to get fitter, they want to get some exercise. Maybe their doctor's telling them, you need to get your blood pressure down, you need to do this and that. So if that's important to them, it fits right within this idea of behavioral activation, of breaking that pattern. We identify those valued activities and get them doing those. So when people are doing things that are important to them, valued activities, then their mood starts to improve and it makes it easier for them to do more.
Sure.
And so then you get this new cycle, this new habit, but it's a healthy one and it's a happy one. So we kind of help people to get what they want out of life. It's basically what behavioral activation does.
And how many sessions would be typical in that treatment of behavioral activation?
Usually 12 weekly sessions.
Okay.
And one of the nice things about it is it's a little more intense up front. So it's definitely an hour each session up front.
Okay.
And there's lots of take-home monitoring where they're tracking what they're doing and how important it is, how enjoyable it is for each hour of the day. So it's an effort. It's a lot of effort. But then after about 6 sessions or so, for most people it becomes easier. The monitoring, they get used to the monitoring, and they spend most of their time picking the next great activity that they want, picking the next step in getting to the life they want to live.
So the activities that are engaging and rewarding, they want to do more of, so it's easier to monitor those, easier to do those, and as you do that, the behaviors and the mood come along.
And the therapist becomes more of a consultant.
Yeah.
They become less of someone who's helping to direct the person toward the life they want to live and just helping them troubleshoot any little difficulties they have on the way there.
Sure. And as you showed us in the lab earlier, as these patients would make changes in depression, your research dovetails nicely with the clinical work, showing that perhaps even their reactivity, their response to stress will become more adaptive as well.
Right, exactly. And as you can imagine, someone who feels more confident, feels better about themselves, and is happier can walk into a stressful situation and deal with it a little better.
Sure. A little more reserve.
Right, exactly.
Yeah,
they're more resilient. That's right. It becomes this question of, do you want to be at risk or do you want to be resilient? And BA is behavioral activation is one way of building resilience for people who are depressed. So they can, instead of being at risk for whatever problem, in this case we're looking at cardiovascular disease, but instead of being at risk, they're resilient, they're stronger,
Sure.
mentally and hopefully physically.
Well, this is important and exciting work. Where does it go next? Where do you see the horizon for your work?
Well, for me, the very next step is bigger.
Okay.
So bringing in more people,
Okay.
measuring more things. So instead of
Okay.
just a cardiovascular response to
Sure.
stress, let's look at how people's like lipid levels change. So their cholesterol, how that might change. Another big risk factor for
Sure.
heart disease, right? Things like that, how those might change. And can I bring in more East Carolinians?
Mm-hmm.
And this has the side point of, I want to help the people around here.
Yeah.
So by doing these studies, I bring in more people and get them depression treatment.
Absolutely.
So that's the very next step. So
Okay.
that's like a 5 to 10 year model. Over the course of my career, I really want to get to the point where I can go around to the various medical centers with all the research that I've done and the evidence that I've gained and help them to identify people who are at risk for cardiovascular disease because of their depression and help them to institute the appropriate treatment for it.
Those are great goals. I think one of the things I'm impressed by as you talk is that integration of the biologic aspects, the psychological aspects, the social aspects, the behavioral aspects.
Mm-hmm.
When you bring that picture together, it makes a lot of sense that patients would benefit in both mind and body health
Mm-hmm.
again. And it brings us to a great way to end our session and our talk today. Thanks so much for sharing with us, Dr. Whited, and we wish you well.
Well, thank you.
Keep up the great work here at East Carolina.
Oh, I will.